in making this process. And I'd like also to thank Desiree, the project manager of Empower as well. So, and I'd like also to thank all the speakers and the experts that are today with us, and they are going to participate in the panel discussion. So the aim of this webinar is to bring together experts and stakeholders to learn and discuss the issue of mental health in the workplace across Europe. And the agenda of this webinar is as follows. So first, we have with us Dr. Ledia Lazeri. She's the regional advisor for mental health in the WHO, and she will give us some opening remarks. Then we have representatives from each sister project to give us also an overview of the projects that were funded by the European Commission. Then we have a short break, and we will continue with the panel discussion moderated by Professor Luis Salvador Carulla. Finally, we will close the webinar with some conclusions and remarks. So I'd like to introduce them, Dr. Ledia Lazeri. I don't know if Jose Luis, would you like to continue?
Yes, I will do the introduction. Thank you very much, Beatriz, and thank you to all the people that have manifest interest on joining us. I think that at some point, I mean, we will have up to 160 people that wanted to follow us, which is very good, because we know it's a topic which is, I mean, for us that we are working on this, we know it's very interesting, but knowing that there's a lot of people outside that also share this interest is also very reinforcing. No? And then in establishing the program on for this activity, we think that it was very good to have to speak at the beginning. What are the views? What is the perspective of the WHO, and particularly of the European Office of the WHO? And for that, we are very lucky to have with us Dr. Ledia Lazeri, which is the new regional advisor for mental health. She's a psychiatrist by training. She has a very long experience working in the WHO at different positions in different countries and programs since the 2000. And she came to this post of a regional advisor very recently in May 2021. But in this very short period of time, she has been very active, and I just want to highlight two important things that happened in the last months, which are very relevant for mental health. She was instrumental in organizing and leading the Athens Summit on actions required to address the impact of COVID pandemic on mental health that took place in Athens. It was a high-level ministerial conference, and I think that it was extremely useful to mobilize support of the policymakers at the European level for mental health and the COVID, and we are really very grateful of this initiative. And more recently, and I'm sure we will hear about that, she launched the Pan-European Mental Health Coalition in September in Belgium. So with this, Ledia, the floor is yours. Again, thank you very much for accepting to be with us today.
Thank you. Thank you very much, Jose Luis, for your very kind introduction. And I'm honored to have been invited to join you today, and very impressed of the growing participation. I can see the number of participants grows by the minute. So I'm truly honored, and thank you for inviting me. As Jose Luis mentioned, I have only joined this position while I'm in WHO for more than 2 decades. I've been in this position for like a bit less than 6 months, but I was the lucky one, I think, because there cannot be a better time of being a mental health worker than now, because there is so much interest, focus, commitment, attention around mental health, that the opportunities about moving forward the agenda, the mental health agenda in Europe, are are bigger than ever. But with opportunities come also responsibility. And when it comes to discuss about what to do, it means that all this attention and this commitment puts us in the spot for delivering. And that's why I'm very happy to be here today, because this activity is actually very much in line with what we have learned so far from before the pandemic, but also during the pandemic. So to make the long story short, the pandemic, COVID-19 pandemic, uncovered how unprepared mental health systems were to cope with the demand and the need of the population. What we understood from the very beginning is that due to not only restrictions that affected mental health of the public, but also to the repurposing of health services, mental health services, the delivery of mental health services in many instances stopped or was very, very reduced, which means that the treatment gap, the huge treatment gap that we already had in Europe was further worsened. And that became so obvious that there is no country in the WHO European region that can now afford not to take action, which is why mental health is so high in the agenda of everybody. Now, for those of you in the audience that probably wonder why did I specify the WHO European region, is that for us in WHO Europe, the region is far beyond, it goes far beyond the European Union borders, and our region starts at the east, at the west, with countries like Finland and Norway and Portugal and UK, but goes further east into Central Asia with countries like Kyrgyzstan, Tajikistan, Uzbekistan that are obviously in the Central Asia. So our the spread of our region is huge. It's a very diverse region, and our challenge, one of the challenges in WHO Europe, is to maintain coherence in between the needs and demands of all those countries. And when I say treatment gap, you please focus, please try to understand that if the treatment gap is already relevant and mental health treatment gap is already significant into the well-resourced EU countries, it's even more relevant and significant in those countries that have less mental health resources and mental health budgets. And that's why mental health in the workplace, it's not only something that needs to be actioned now, but it's also an additional channel that helps us as mental health workers to improve, to strive for improving mental health of the population. Now, what happened before COVID is that when it comes to mental health in the workplace, as per the Mental Health Atlas, WHO Mental Health Atlas of 2017, so it was before COVID, what happened is that out of about 159 mental health programs that were reported by our member states, we have 53 member states in the WHO European region, only 7% of those programs were related to work, to mental health promotion in the workplace. So this is just to tell how marginal mental health in the workplace has traditionally been in our region. And this is not to say that this is the first time we are talking about, and you better than myself know that you have talked about mental health in the workplace before, but never before now it has been so obvious why we need to intensify actions and resources and evidence and capacities into addressing mental health in the workplace. Also, another lesson learned from COVID-19 pandemic, the mental health impacts of COVID-19, is that due to the pandemic restrictions, mental health at the workplace was affected in two ways. One, because every worker, every employee has been affected directly or indirectly by the pandemic, either by having people, sick people, infected people in the family, or being infected themselves, or being laid down, lost their jobs. So people the workplace was no longer this, providing the security that people do anticipate into when they relate to the workplace. And that's why approaching mental health in the workplace is now more actual than ever. In response to those lessons learned, the new European Framework for Action in Mental Health has identified mental health in the workplace as one of the priorities to be taken. And of course, it has been informed by the evidence that our technical advisory group on mental health impacts of COVID-19 found. And I'm very happy to highlight that Jose Luis was one very, very active member of our technical advisory group and was very instrumental in providing the evidence that informed then the European policy making. So, as I mentioned, the mental health in the workplace is one of the priorities laid down in the European Framework for Action on Mental Health. And to also inform you how serious we in WHO are about mental health in the workplace, is that the newly launched Pan-European Mental Health Coalition that was established in September this year is innovative, not only because it brings together people from all over the WHO European region, but it's innovative because it doesn't only bring together the usual suspects. And in mental health, the usual suspects are mental health professionals, mental health policymakers, mental health users and carers, and mental health advocates. This time, in the Pan-European Mental Health Coalition, we also are striving to have in representatives of employers and labor organizations, with the understanding that you can't address mental health in the workplace without talking to those who are responsible for providing the conditions and well-being premises for their employees. And this proves to be a bit more challenging because those parties have never before been on the fora for mental health. And we now need to establish some trust and some confidence so that those partners come in, join, and contribute as intended, as needed. Another moment that I would like to highlight is that the coalition as a new entity, as a voluntary gathering of partners, is not only about mainstreaming action in mental health, but it's also about gathering evidence, which is why this forum today, for instance, is very, very important, because I hope it will serve as a call also to researchers to further provide evidence about mental health in the workplace. What we knew, for instance, before the pandemic, is that some research that happened in England provided solid data about savings that were generated because of early intervention programs at the workplace. So when early screening for depression and anxiety on workers in the workplace were taken, there were very significant savings. So the savings were true also for well-being interventions in the workplace. And in that sense, if we can generate this kind of research, we have better chances of convincing those who make the policies, those who provide the regulations, convincing them why it's important to invest in the workplace. So I hope that this forum can serve us for encouraging not only employers, not only the policymakers, but also researchers for taking forward the actions to provide evidence so that those who are in charge can take action. And with this, I'm happy to take any question if there is any, but I want to wish you the very best for the day. Thank you. Over.
Thank you so much, Ledia, for this overview of this challenging of mental health in the workplace.